process, this transverse, articular process, and vertebral arches. Now, vertebral bodies. What junction we have between vertebral bodies?
Intervertebral disc.
What structure has this intervertebral disc, discus intervertebralis? What structure it has? It is cartilaginous disc. Especially it is thicker in what part of vertebra? In cervical or in lumbar? In lumbar it is thicker. What structure has this disc? Intervertebral disc. What structure it has? Discus. On periphery it consists of atlas. Fibrous rings. Annulus fibrosus. Fibrous rings. Collagen fibers. On periphery form. No, it is not cartilage. On periphery it forms cartilage, this fibrous ring, annulus fibrosus. In center, nucleus pulposus, remnant of chorda. It is remnant of chorda. It is soft jelly-like structure in the center, which reduces friction between vertebrae during movement. What type of junction does we have between vertebral bodies? This type of junction is called synchondrosis. Syn, Greek word, junction, chondros, cartilaginous. Synchondrosis, it means junction between vertebral bodies by means cartilaginous tissue. Synchondrosis. But also in lumbar part, we have inside this cartilage, some cleft may be present, like hemiarthrosis or symphysis in lumbar part of vertebral column between the vertebra, maybe symphysis in between vertebral bodies, maybe symphysis, hemiarthrosis. Vertebral bodies also connected by means longitudinal ligament in front. This ligament in front, what name has? Ligamentum longitudinale anterius. Extends from the tuberculum anterius of first vertebra. What name has first vertebra? Atlas. From atlas along the vertebral bodies until coccygeal. No, the anterior surface of the sacrum it ended here. Ligamentum longitudinale anterius. And behind the bodies, ligamentum longitudinale posterius. Can you show on picture? Ligamentum longitudinale posterius. Usually students show anterior, in front, posterior, no here. Inside vertebral canal, behind the bodies. That is why posterior you can show only inside. After here it has been removed arches, the vertebral arches you must remove, and inside show where posterior, no here, here, inside, here, along posterior margin surface of the vertebral bodies. Do you understand? Yes. From along posterior goes ligamentum longitudinale posterius. What movements restricts this ligament? Anterior extension and posterior flexion. Regulate flexion, extension of the vertebral column. And between arches, what ligament we have between arches? This ligament on fresh preparation has color of yellow color. It is called ligamentum flammum. What ligament we have between transverse processes and spinous processes? Between transverse processes, intertransverse ligament. Between spinous process, interspinous ligament. Interspinous ligament, which is on cervical region. What ligament forms? Interspinal ligament. This intertransverse and interspinous for you. Interspinous continues on the apex of spinous process as well as ligament. Supraspinous, which in cervical region forms what ligamentum? Nuchal ligament. Ligamentum nuchae. Because the cervical vertebrae, they have very small spinous process. What ligament attach? The supraspinous ligament becomes wider and attached by crista occipitalis externa, protuberantio occipitalis externa. It is called in sagittal section. It is directed, this ligamentum nuchae. This ligament, can you find in atlas? It's better find in atlas. In your textbook you have not this picture. Ligamentum nuchae. Thus we have ligamentum flavum, interspinous ligament, supraspinous ligament, intertransverse ligament. They are all example of fibrous junction by means ligaments. And fibrous junction we have also between bodies, longitudinal ligaments, anterior, posterior. But between bodies we have also synchondrosis, the example of junction by means cartilaginous tissue. On example of the sacrum we have synostosis, bony junction. 5 vertebrae fused together form one bone, or sacrum, triangular shape, and coccygeal vertebra also fused together form os coccygis. And what prominent point is formed between 5th vertebra and sacrum? What name has? Promontorium. And what ligaments here we have? Sacrococcygeal, lateral, ventral dorsal ligament, and lateral ligaments goes from the sacrum to the coccyges. Between os coccygis and sacrum we have symphysis. Due to this symphysis, it is hemiarthrosis, hemijunction. During childbirth, os coccygis slightly can move backward and increase the pathway through which the head of the baby, newborn baby, must be passed. Goes some slightly, and also the pregnant woman pelvis. In front we have pubic symphysis. The pubic symphysis also slightly becomes widened and can move. That is why after childbirth the female pelvis slightly becomes wider due to symphysis, pubic symphysis, and during childbirth important this sacrococcygeal hemiarthrosis. They understand junction by means ligaments, cartilaginous tissue, and between articular processes. What junction we have between articular processes? Here on lateral sides we can say the vertebrae have articular processes. Yes, superior, inferior. What junction they form by means these articular processes? They are called, old name of the junction, intervertebral articulation. Articulationes intervertebralis. But now it is called, in accordance with latest nomenclature, Parisian nomenclature, anatomical, it is called zygapophyseal junction. Articulaciones zygapophyseales. Zygapophyseales junction. The junction between articular processes. Zygos, it means arch, and on arch we have, like apophysis, these articular processes. Zygapophyseal junction. Greek name of this junction. What junction they form? They are combined junction. If we move on one side, it is obligatory moves on opposite side, contralateral, on left and right together move. This type of junction, anatomically different, but function together. What name they have? Combined junction. Combined junction between vertebral articular processes, left and right, articulaciones intervertebralis, or zygapophyseal junction. They are combined. And what type of junction? Flat. They are flat junction between flat articular processes. One process, for example, in thoracic part, they are located in this flat surfaces. From these flat surfaces belong to a multi-axial junction. Multi-axial, slightly gliding movements in all axes. Multi-axial junction they form. Flat, plane, articulatio plana, flat junction, it is like ball and socket junction, belongs to multi-axial junction. But they have very small range of movement, but all together, all this intervertebral articulation allows to form movements along 3 axes. What 3 axes of movements we have? You can see here this 3 axes. the transverse frontal axis, what movements we can perform? Bending, abduction and adduction to midline. Abduction from midline, adduction to midline. Then frontal transverse axis. What axis is this? Green direction. Anterior, posterior. What name has? Sagittal. I ask axis. Axis is sagittal. Around the sagittal. Sagittal. Around the sagittal axis, we have these bending movements, right and left. Abduction, adduction. On frontal axis, what movements we have? Flexion, extension, bending forward and backward. Flexion, extension on transverse axis. On sagittal, we have abduction, adduction. And red color is what axis? Verticalis or longitudinalis. This twisting movements, rotational movements. Rotational movements of the vertebral column. Especially complicated junction we have between skull and first and second vertebra. What name has this first vertebra?
Atlas.
Atlas. What junction we have? Atlanto-occipital. Occipital condyles form with atlas. And this is axis with atlas. Especially vertebral column with skull forms this very complicated junction, which consists of two levels, two stories, levels. First story is what? Atlanto-occipital, and second story, lower story is low level is atlanto-axial. This you will say junction of vertebral column with the skull consists of two levels of junction, atlanto-occipital and atlanto-axial. We'll describe each junction. Atlanto-occipital junction is formed between ellipsoid, occipital, ellipsoid in shape, condyles of occipital bone, in Latin, condylus occipitalis, ossis occipitalis, and superior articular surface of atlas, which is slightly concave, ellipsoid, convex and concave surface, which are covered by cartilaginous tissue from atlanto-occipital joint. This joint in front and behind covered by articular capsule and which is attached to the margins of this cartilaginous tissue, the articular cartilage, covered by capsule, which is reinforced by ligaments between posterior arch of atlas and posterior part of foramen magnum. Goes ligament, but it is white ligament. White ligaments in anatomy, they are called membrane. This atlanto-occipital posterior membrane. Ligament is narrow, but white is called membrane. Membrana atlanto-occipitalis. For example, here we have white ligament between cartilaginous. It is also called intercostal membrane. Here it is called what? Atlanto-occipital posterior membrane. And in front?
Atlanto-occipital
anterior membrane. Membrana atlanto-occipitalis anterior and posterior, two ligaments which reinforce this junction in front and behind. What shape has this junction? Ellipsoid biaxial junction. What axis it has? Transverse frontal axis, flexion, extension, flexion, extension we have. On sagittal axis, abduction, adduction, abduction, adduction. From midline you abduct, no lateral bending, and adduct on sagittal axis. Rotation here we have not in this junction. Biaxial ellipsoid. We can perform circumduction. Circumduction is not rotatio. Rotatio is this, rotatio. But circumduction is this. Circumduction, you can combine all movements, flexion, abduction, extension, all together. All these movements, combination, is called circumductio. It is not separate movements, it is combination of movements, but not rotational. That is, true movements are free, flexion, extension, abduction, adduction, and rotation. Rotation here absent, it is only biaxial joint. Next flow, lower flow, is formed by Atlanta axial. But here we have three junction. Two lateral, zygapophyseal junction is all other intervertebral junction we have. But also the second vertebra has additional these processes which is called dense axis, which form separate junction with atlas fovea dentis. That is why we have three articulation. Atlanto-occipital lateral, paired and unpaired. Atlanto-occipital middle, no medial. Lateral and middle. On midline line, unpaired. Medial usually paired. It is middle, unpaired. And you will explain each articulation. The lateral is formed between inferior articular surface of atlas, superior articular surface of axis. As all intervertebral, they are plain multi-axial junctions with three axes of movement. But atlantoaxial middle junction is formed between dense axis, which has, you will name, articular surfaces. Facies articularis anterior dentis with fovea dentis from one side. From posterior surface, facies articularis posterior dentis forms junction with ligament which extends between two massa lateralis. Between two lateral massa, we have ligamentum transversum atlantis. It is visible here, the transverse ligament, ligamentum transversum, which fixates dense between atlas in this ring. It lies, if you will see from above, it lies in bony fibrous ring, and inside where the ligamentum transversum attach, it extends here. In the center, inside of this ligament, present cartilaginous tissue, which form articulation with this posterior surface. Thus, dense axis lies in bony and fibrous ring. Why it is enclosed in this ring and reinforced by many ligaments. From apex to the occipital bone goes ligamentum apicis. On both sides we have ligamentum alare. Why it is reinforced? This apicis dentis. On both sides ligamentum alare. This junction is very important. What foramen is this? Foramen magnum. And then first foramen of the atlas. This is transitional part from the brain to spinal cord. Here, the medulla oblongata, part of the brain, continues with spinal cord. And displacement of atlantoaxial middle gen will be very dangerous, yes, for the medulla oblongata, in which are located many reflector centers of cardiovascular center, respiratory center. That is why sometimes maybe car accidents or at swimmers, then very dangerous, they can fall down and fracture of the base of the skull. Fracture of the bones of the base of the skull is very dangerous because displacement of this fracture of the bones and displacement of axis cause immediately death. That is what this junction could not displace, must be fixated very good. Ligamentum transversum fixated, ligamentum apicis, ligamenta alaria, and also above ligamenta alaria, which lies below, fasciculus longitudinalis. This is fasciculus longitudinalis. This fasciculus, what ligament? Alaria, да? Apical, да? Это ligamentum, no alaria, apicis. Alaria on both sides, this lateral. Above this apicis also passes fasciculus, this apicis, this transverse. Above apicis also passes fasciculus longitudinalis, superficially. Fasciculus longitudinalis, which together with ligamentum transversum form ligamentum cruciforme. Fasciculus longitudinalis and transversum ligament together form ligamentum cruciforme atlantis, crusade ligament of atlas. And all these structures, all these ligaments, superficially continue with membrana tectoria. This fasciculus longitudinalis and transversum form ligamentum cruciforme atlantis, number 3, ligamentum cruciforme, which are covered by membrana tectoria. This membrana tectoria, continuation of ligamentum longitudinale posterior in this region, membrana tectoria. Continuation of ligamentum longitudinale posterior. What shape has this bone? It is cylindrical in shape, cylindrical in shape, pivot junction with vertical axis. We can only perform what movement? Rotational. Thus, second level, rotational movement, upper level, by XL, flexion, extension, abduction, adduction. Junction of the vertebral column and head allows three type of movements: flexion, extension, abduction, adduction, and rotation. And of course, circumduction. Do you understand this? This vertebral column junction. And now ribs junction. Ribs with sternum. What junction form? Sternocostal. But only what ribs? True ribs. From 1st to 7. This you will listen also during lecture. Sternocostal junction. Incisura costalis sterni. And sternal end of the ribs, cartilages of the ribs has cartilaginous part and costal part. This is, each rib has sternal anterior end and posterior head. Head form junction with vertebral bodies, and tuberculum form junction with vertebral transverse processes, thoracic vertebrate vein. Costa vertebral junction consists of two articulations: articulatio capitis and articulatio of transverse process. I will demonstrate on atlas when we will sit in our room. In front we have sternocostal articulation. Sternocostal immovable plain joint, but only 7 ribs form this. No, first synchondrosis by means cartilaginous tissue is connected. From 2nd to 7th form articulation, and this articulation is reinforced by radiate ligament, ligamentum sternocostalis radiatum, which reinforced it. Here you can see this junction. From outside, you can see it is reinforced by the radial ligament. I will show in atlas. From the back, on the 8, 9, 10 ribs form intercartilaginous articulation. 11, 12 don't form junction, don't have junction. Let's go to our room and